Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joining everyone this afternoon to provide an update on where things stand with respect to COVID-19 across the state of Maine for today, Monday, July 6th, 2020. I begin today's briefing on an unfortunate and sad note. Over the past few days, since our last meeting, 4 individuals across the state have passed away with COVID-19. They were all from Cumberland County. One was a woman in her 80s, another was a woman in her 90s, the third was a man in his 80s, and the fourth was a woman in her 60s. All 4 individuals were in Cumberland County. I'd like to take a moment to recognize their passing and extend our deepest condolences to the family members and friends of these 4 individuals during this time of their hardship and grief. Overall, across the state of Maine, there are now 3,423 cases of COVID-19. That represents an increase of 8 cases since yesterday. Of those, 3,034 are laboratory confirmed and 389 are probable. Overall in the state, there have been now 109 individuals who have passed away with COVID-19. And overall, 2,787 individuals have recovered, an increase of 15 recoveries since yesterday. Right now in the state, there are 21 individuals in the hospital, 9 of whom are in the intensive care unit and 4 of whom are on ventilators. And of our cases, 823 have been among healthcare workers. Since Maine CDC began our activation, we've now fielded over 10,000 consultation requests from healthcare providers and individuals across the state. That's just over a matter of a few months. So I'd like to take a second to thank our team of epidemiologists who have fielded each and every one of these phone calls and with as much speed and accuracy as possible have gotten you, the folks who have been calling, answers, especially at a time when having those answers quickly and accurately has been at a premium. I'd like to take a second to thank our epidemiology team for that work. A few other updates for the day. Maine CDC continues our work with our colleagues at the National Guard, who are continuing to undertake fit testing missions across the state. Today alone, members of the Guard are fit testing nearly 100 individuals across the state. And by the end of today, nearly 3,000 individual healthcare workers statewide will have been fit tested for use and safety for N95 mask wearing. I'd again like to take a second to thank the Guard for their continual partnership. I'd also like to provide an update on where things stand with respect to testing across the state. I'd like to first provide an update on yesterday's testing numbers, then put those in the 7-day context as well as the cumulative context. So yesterday, just in the state of Maine, there were roughly 1,600 PCR tests conducted. Of those PCR tests that were done in the state, approximately 8 were positive, which brings yesterday's 1-day point positivity rate to 0.5%. The number that we really focus on quite a bit and that we've talked about at these meetings is the 7-day weighted average of all the PCR tests conducted in the state. And as of today, that 7-day weighted average number now sits at 1.53% over the past 7 days. The other number that we also take a look at is the cumulative positivity rate. Since Maine CDC and the country started testing for COVID-19, our cumulative positivity rate now sits at 3.6%, representing almost 109,000 PCR tests that have been done across the state. I'd also like to provide a quick update as to where things stand in the volume of tests that have been done across the state. Currently, our testing volume sits at about 152 tests per 100,000 individuals in Maine, based on a 7-day moving average again. That number has been increasing. In fact, just in the past 2 weeks, that number has increased by 42%, from 107 tests per 100,000 to now, as of this morning, 152 tests per 100,000. Now, I'd like to take a moment to put some of these figures in context. These numbers are positive, and they suggest that we are on the right path. But I'd like to be very clear, they are not a cause for celebration for a number of reasons. The first is that, as a reminder, the numbers that we see today are really just a snapshot of transmissions that occurred 2 to 3 weeks ago in the state. So what we're seeing is, again, a picture of a very fast-moving train, and at that, it's a picture that is maybe 2 weeks old at this point. That's a time before many of us were, for example, starting to get together. The numbers that I've just shared, the positivity rates, the numbers of new positive cases, could change for the worse, unfortunately, as has happened in a number of southern and western states across the country. Even though these numbers are encouraging, they are not an occasion to let our guard down. We are still in this. Specifically, there remains a pronounced risk of outbreaks, particularly in nursing facilities, as well as congregate settings of all types, including now an increase of outbreaks in workplace settings. In addition, these numbers paper over the very significant racial and ethnic disparities that we have discussed on multiple occasions. Those are not and have not yet gone away. So the bottom line is, even though we may be on a good path right now, things could change. And either way, we still have significant amounts of work ahead of us. Now, many of you, including myself, may have spent time this past holiday weekend reconnecting with friends and family, perhaps even in person rather than via Zoom. That's a good thing. We're all of us, looking for ways to return to normalcy. Although, frankly, I'm not sure what normalcy might look like. Perhaps what we should be striving for is normal-ish at this point. One of the ways that we can usher that process along is by making more widespread use of face coverings. There are 2 discussions that are happening nationally right now with respect to face coverings. One of them is a scientific discussion. We've talked a lot about that at these meetings. There are a number of recent publications that make a strong, compelling case for widespread use of face coverings as a way to reduce transmission of COVID-19. We've talked about some of that science. And the science tells us what face coverings do. But I'd like to take a moment today to talk about why face coverings make sense in practical terms. What's the purpose of face coverings, and why do all of us wearing them, especially when we are out in public, why does that make sense? The purpose behind face coverings is to create a norm. This isn't a new thing. In fact, it's something that many of us, if not all of us, are used to every single day. One of the most common norms that we all abide and are used to is the speed limit. Face coverings are like that. If we all abide the speed limit, we can all move about the roads more safely. The speed limit, much like face coverings, are a way for all of us to coexist with one another in a safe manner. With speed limits, we can all get to where we're going in ways that lower the risk for all of us. Specifically, if you and I both abide by the speed limit, as we're both, say, going to and from work, each of us, all of us, has a better chance of making our journeys in a safe manner. That's the premise behind a speed limit. It reduces our collective risk. Face coverings are no different. I lower my risk to you when I wear a face covering. You lower your risk to me when you do the same. And as a result, all of us are safer, just as with the speed limit. The goal of the speed limit is not to force everyone to conform to a single speed. The goal is for each of us, all of us, to be that much safer. Similarly, the reason for a speed limit isn't to penalize people who break it. The reason we have a speed limit is far more practical. It's to avoid a massive pileup on the highway. Likewise, the reason for face coverings isn't to shame or punish those who don't wear them. It's to avoid the equivalent of a COVID crash on our highways. One of the things that we've seen in the past few weeks is that what these and other public health laws, recommendations, and requirements have in common is a desire that we all lead our communities to a place that protects all of us. Abiding by the face covering rules means that there is less spread of a highly contagious virus. It means that there are more lives that can be saved, and candidly, a faster return to some degree of normal-ish for all of us, to say nothing of making sure that healthcare providers have a lower burden of patients that they have to take care of. Far from being some sort of obstacle to the resumption of economic and social life, things like face coverings are one of the mechanisms by which we can get ourselves back to that degree of normal-ish as we are all starting to reopen and reconnect with friends and family more. So with that, I'd like to turn things now over to our colleagues in the media to hear what's going on in their world. And we will start by turning to Patty White at Maine Public. Patty? Patty, we're going to come back.
Hi, Dr. Shah. Sorry about that. Can you hear me?
Yep, go ahead, Patty.
Thanks so much. I was hoping you could give us an update on the new mobile lab that I think was supposed to be set up this month that was going to expand testing capacity. Is that up and running yet?
Our target date for the mobile lab being online has been and remains later this month. We're targeting July 17th. That's the most optimistic date. There may be a couple of days on either side as we continue to make sure everything is up and running. But since we announced that, our intention has always been to recognize that making sure we had the lab situated correctly, all the various filters, plumbing lines, IT systems connected, to say nothing of the staffing, hiring that's ongoing right now. We always figured it would take roughly a month, if not a bit longer. We remain on track with that project. Once it's up and running, we will, of course, be able to conduct significantly more tests than we're even conducting right now. And so as we get closer to the target date of when we hope to be online, we'll have updates on that. Right now, we're on track, but as with all projects with moving pieces, we want to make sure it stays that way.
Great. Can you also give us an update on the swab and send testing sites? I think there was a goal to set up 20 of those. How many have been set up so far?
So we received a number of applications. It's a rolling process. So there wasn't a specific close date as much as there was a rolling time in which interested parties could submit applications. We've received a fair number of them. The team is actually reviewing those this week to try to make sure that they conform to what the state is looking for. Once that process is underway, and it's a fairly quick process, we'll be able to start working with the entities that have expressed interest, getting them the funding that they would need to move forward.
Comment.
And so, I think some folks are not on mute. Could just ask everyone to check to make sure everyone is on mute. Yep, so Patty, the goal is still to get those set up pretty quickly. And we are reviewing the applications right now.
Okay, great. So none have been set up so far, and it sounds like And do you have a sense of, I mean, I guess, do you have more than 20 applicants, or how many applications do you have?
I don't think we got 20 applicants. I think it was a hair under 20. I haven't seen the exact final list of what we've gotten. As a reminder though, Patty, there's not a single application deadline. Individuals can continue to submit applications to us as things move forward. So I don't know exactly how many we got in this initial batch, but the goal right now is to make sure we review those and get those parties stood up as quickly as possible.
Okay, thank you.
I'm going to turn next to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have two questions for you. I was just wondering if you could give us a little update on Massachusetts being left off the decision for having to quarantine when they come to the state, and if you'd had any conversations with your counterparts there about those decisions.
Sure thing, Brian. So let's start first with the approach that we've taken to evaluating other states. The principle that we use is that when we're thinking about whether another state should be exempted or from the requirement to either quarantine or get a negative test, the principle is whether, based on the current epidemiological situation in that state, the risk of a traveler from that state is the same as or lower than the risk of someone in Maine having COVID-19. We look at a number of factors. We don't just base our analysis on one factor. We look at a number of factors in tandem. But the two that we really do focus on, in addition to many, but two that we really pay attention to, are the recent incidents, that is to say, the number of new cases per million in the past week within that state, and the positivity rate over the past week. And for those, we like to see numbers that are the same as where Maine is or better. When we cut off the numbers for our analysis last week, at that time, the only states that had met that threshold, in addition to Vermont and New Hampshire, were Connecticut, New York, and New Jersey. We are continuing to take a look at the data for Massachusetts, Rhode Island, as well as a number of other states. Brian, I have had the chance to connect with my counterparts in both Massachusetts and Rhode Island. Explain to them the basis for how we went about thinking about this. I'm actually going to speak with my counterpart in Massachusetts again this evening. The data are changing on a frequent basis, and as those data change, we want to balance our analysis to match that.
And my next question, Dr. Shah, is about a face covering mandate that perhaps is going to be coming soon. And I guess we've gone through these briefings quite a bit where at the end of your presentation, you say something that seems to be very important to you. I guess, why did you feel that you needed to reaffirm the face covering mandate? Are you getting any kind of, or your face covering advice? Are you getting information that tells you people aren't wearing face coverings? And when might that mandate be coming from the governor, if you could tell us that at all?
Sure. I know that the governor's office is working on that. I expect it to be out very soon. The governor's office would have the exact timeline, but my understanding is very soon. But Brian, you're right. As to the former point, face coverings are important. They're important to me personally, as someone who spends time with folks who are elderly and so on and so forth. I think they're important for all of us. I'm sure as many of you have heard reports from friends, coworkers, family members who have been out and about in recent days and saw a lot of folks without face coverings on, particularly when they were in situations where physical distancing wasn't possible. Brian, what I think I'll say in response to your very good question is I want to share some of the reasons why I personally wear face coverings. The first is that the science tells us that they work. That's important. We should always, in public health, start our analysis with the science. Another reason I wear them is simple humility. I try to stay really careful to avoid COVID-19, but candidly, I don't know if I don't have it. I feel fine, but as we've all seen, many individuals can spread the disease before they start showing symptoms. That's the reason why face coverings are so important. It's that time period before you know you have the disease. So the second reason is humility. A third reason is kindness. I don't know if the person who I'm standing next to at the grocery store is caring for an elderly relative or has a child at home who might be on chemotherapy or has a brother who just got a liver transplant and is immunosuppressed. I don't know if that person interacts with one of those folks on a daily basis. And so in order to be kind to them, I want to make sure that I try to protect them as well. Another reason is simple compassion, right? It's the same idea. It's what we owe to one another in a civilized society. And the fifth reason is community, right? The road signs that are on the expressway say this: we are all in this together. In that respect, it's similar to the speed limit, right? The reason among many that I think we all obey the speed limit is because we don't want to put someone else at risk. And face coverings are very similar. So yeah, I think it's something that we should have a dialogue about and have a conversation about by all means, but do so recognizing that the science behind them is very compelling. And it takes us back to one of the most fundamental questions of any society, which is what do we owe to one another? And in a situation like this, with a pandemic raging, I think a face covering is at minimum what we owe to one another. I'm going to turn next to Megan at WMTW. Megan?
Hi, Dr. Shah. My question is as it relates to face coverings, kind of what we were just talking about, but I'm wondering if you can clear up a little bit of the guidance. I know in cases where you are not able to socially distance and you can't, maintain that 6 feet, they are recommended and may soon be mandatory. But what, for example, if you are outside and you are, let's say, on the beach and you may not be exactly 6 feet from someone, are face coverings required or recommended in that kind of setting where you're outside and you are maybe a little too close? Or is outside kind of one of those things where it's, your discretion?
Yep, I totally hear where you're coming from, Megan. Absolutely. Okay. And I've been thinking about that a lot too. As with so many questions, there are going to be edge cases, right? So you're 7 feet away, but the wind is blowing downstream. And so there's going to be these edge cases. What I recommend are two things. The first is if you're in doubt, the easiest thing to do, the safest thing to do for everybody is to wear a face covering. If you've got even a sliver of doubt, if you've got to even take the time to ask yourself whether you should throw a face covering on, the answer is probably yes. The second question is that if you're not around anybody, right, a face covering doesn't serve any purpose. But for example, just a few days ago, my family and I went out for a walk in the woods, and there were other people on the trail. When we saw them coming down the trail 20 or 30 yards in front of us, we put our face coverings on. Even though the nature of the contact that we were going to have with the others was only a few seconds long, I think it's a sign of respect, among other things. So there are going to be difficult situations. There are going to be edge cases. What I would ask is that folks be sensible and take the possibility of transmitting a disease to others into mind as you're deciding whether to put a face covering on. And if in doubt, throw one on.
May I also ask you about the today's case count? I know you said that this is no reason to really celebrate, obviously, because this, again, the fast-moving train. However, is it an indicator that cases are going to be lower, or do you think this is just some sort of statistical outlier that we have cases in the single digits that we're reporting?
Yep, Megan, my team and I talked about that this morning. It's impossible to predict, of course, but it is more likely that the low case numbers today reflect a bit of a holiday weekend effect. That being said, there were still a robust number of tests conducted, about 1,600 yesterday and about 2,000 the day before. That being said, it's also likely that what we're also seeing in terms of the low case numbers is more of a holiday weekend effect.
Thank you.
Mm-hmm. I'm going to turn next to Pat Callahan at News Center.
Good afternoon, Dr. Shah. I'm wondering if you can update us on the Congregate care outbreak at Sedgwood Commons and if you're satisfied with the way that is being managed.
Sure thing. So Pat, as of right now, there are 45 confirmed cases among residents and staff at Sedgwood Commons. What has set Sedgwood Commons apart from many outbreaks that we've been working on is their continual rounds of full testing for both residents as well as for staff. On Friday, we received the results of their latest rounds of testing, and they detected no new cases. They detected no cases among residents or staff. They are going this week again to repeat that full complement of testing. We'll see what we find. But I think it's worth noting that Sedgwood Commons in this setting was proactive in seeking out cases rather than waiting for cases to be brought to their attention. It turned out that in so doing, they detected that there was an outbreak happening. But as a result of notifying Maine CDC, working with us very quickly, we were able to put into place measures, specifically facility level cohorting. That is to say, keeping positive patients with each other and negative patients far away. That type of process probably reduced the likelihood of an even larger outbreak occurring.
All right, thank you, Dr. Shah.
You bet, Pat. We're going to turn now to Caitlin Andrews at the BDN. Hey, Caitlin. All right, we'll come back to Caitlin while we turn to John Greenman at WERU.
Thank you, Dr. Shah. Can you hear me?
I can. Go ahead, John.
Thank you. A few minutes ago, you mentioned how there's not, when no one else is around, that face coverings really don't serve any purpose. And I assume you were meaning when you're outdoors, because the New York Times just today and NPR also mentioned that there are many scientists who have been saying for months that the coronavirus lingers in the air indoors for hours. But the World Health Organization has been slow to agree. And could you explain to us the difference between airborne and aerosol and droplets, and what you're thinking, your Maine's latest thinking is on the difference between those and the importance of one or the other and the way you're thinking about those?
Thank you, John. That's a great question. So let me try to break this down for everybody. I spent a lot of time this weekend diving into this issue as well after seeing a lot of the emails from the groups that are putting together the letter that you noted. So John, here's how it breaks down. One of the things that we've known about COVID-19 since day one is that one of the ways that it spreads is when people exhale or cough or sneeze the droplets that are deep within our lungs. If someone has COVID-19, when that deep exhalation, that cough is out there, we can project the droplets that may harbor the COVID-19 virus. And if someone inhales those, they can get the virus into their system. As a side note, that's why the face coverings are so effective. They block that spread of the droplets. That's been known and recognized almost since the early days of COVID-19. But there's always been a question, a scientific question, of whether or what the size of those droplets needs to be in order for there to be really effective transmission. We've always known that the big droplets could harbor the virus. But what about really small micro droplets, or aerosols as they're called? Could those potentially carry the virus as well? Now, almost from the early days, the World Health Organization, as well as the US CDC, have recognized that there's a theoretical possibility for these small aerosols to convey the virus with them. But much of the thinking has said that the predominant form of transmission has been not via the small aerosols, but via the bigger droplets. There are a number of scientists who believe that evolving more recent data suggests that the small aerosols pose a bigger likelihood of transmission than has been previously appreciated. Now, this might seem like inside baseball. And truthfully, it is a bit of a spectrum, but here's why that matters. And here's why this debate matters for you. If it turns out to be the case that these very small aerosols can transmit the droplets, it might mean a couple of things. One, it might mean that the virus can hang in the air for a longer period of time. The big, heavy droplets fall to the ground immediately. that the lighter, smaller aerosols can linger in the air for perhaps a longer period of time. It may, John, as your question noted, also suggest that folks may consider wearing face coverings indoors, not just when they're in a crowded outdoor space as well. The science on this is as of yet unsettled, but based on the data that I looked at over the weekend, the question in my mind is not whether the small aerosols can contribute to spread, because I think the answer there is they can. The question is how much of the overall transmission of COVID-19 is accounted for by the big droplets versus the small aerosols. Right now, I think the science suggests that most of the transmission is a function of the big droplets rather than the small aerosols, but that balance might change as we get more data. So the question isn't whether, it's how much. So, John, does that answer the question? Did I break it down in the right way?
Very well, Dr. Shah. But it also begs the question about compliance and about enforcement, because a listener called us, actually several listeners have been calling, saying that there are people walking around, and you mentioned this earlier, seems to be a lack of concern among a lot of people about wearing masks in places. The writer asks, well, what good is a law if it isn't enforced? And I don't even know if there is a specific law. I know there's an order, but does that mean there's a law? And is it enforceable? And I guess it should be enforcement people that I say, not you, but you're in the spot.
Yeah, I won't go too far into that topic. I try to just stick with the public health science. But what I will say at a high level, John, is that the governor's executive order has the force of law. And there is an enforcement mechanism built into that will require owners, operators of establishments, large establishments, to make sure that when folks are entering, they are wearing that face covering. So enforcement is definitely a question, but I guess, John, I would ask the same thing about the speed limit too. And when we talk about enforcing the speed limit, who are we really focused on? And we're focused on the really egregious offenders in that situation. And I think we might see the same pattern emerge with face coverings as well. But I will leave enforcement questions to those who are far more knowledgeable than I.
I'm sorry, Dr. Shah, just a quick follow-up. The speed limit analogy is excellent. I personally feel that a loaded gun or a not loaded gun is an excellent analogy too. If somebody is pointing something at you, if somebody's breathing at you and you don't know where they came from, that could be conceivably very, very serious.
There's so many metaphors I think that could drive this point home. The reason I like the speed limit analogy is that I think it's something that we are all used to as a norm. It's something that we just implicitly get. If you're around a school, you don't speed. And it's because we have this concern for others. If you're in a crowded neighborhood where you see a lot of people out, you naturally don't speed. And so partly it's because there's a law on the books, but it's also because I think we all recognize it's the safe thing to do for everybody. And that to me makes it a very good analogy for why face coverings, why we think they're a good approach from a public health perspective.
Thank you, Dr. Shah.
I'm going to turn back to Caitlin Andrews, who indicated that she's back on with some internet problems. Caitlin?
Hi, Dr. Shah. Sorry about that. I don't know if you can hear me or not.
Caitlin, admittedly, it's a bit choppy.
What's happened to the best of us? I was wondering if two things. One, have you closed any outbreaks that have happened?
Hey, Caitlin, we've unfortunately lost you again. I'm gonna try to come back to you in just a second, Caitlin. Your connection's pretty unstable, and so while we come back to Caitlin, I'm going to turn to Kevin Miller.
Great, thank you, Dr. Shah. Just a couple of quick questions on clarifying questions on testing. So right now we're at about, it seems like 1,500, 2,000, 2,200 tests per day, with a range. That range, I imagine that's because just of demand for testing as opposed to your capacity. And kind of what is the capacity of the state lab right now as it stands?
Great. Kevin, as to the former point, you're absolutely right. The variable with respect to the daily testing is a function of demand out there or uptake of testing, what is recommended by clinicians. Our lab itself, our daily capacity right now is just about 1,000 tests per day. We come pretty close to that on some days. There's a very strong day of week effect that's been repeated not just in Maine, but elsewhere. So we're hovering at that near 1,000 tests per day capacity on some days, though not all days. The variance on a day-to-day basis, though, is not a capacity constraint on our end. It's really much more about how the nature of how individuals interact with the healthcare system.
Great, and also on the testing. So when you get the mobile lab set up, through IDEX, are you still anticipating that is going to be able to produce? I think at the time is about 25,000 tests per week. Is that still the anticipation?
That is, Kevin. But with one important note, it probably will not be at 25,000 the day we go live. As with many of our activities, we've been approaching them in a stepwise fashion. So we'll probably start at the lab with one shift, and then go to the mobile lab, and then go to 2 shifts, and then go to 3 shifts as the demand continues to increase. We're not, as you can imagine, we're not going to hire a full complement of folks for 3 shifts only to have the night shift not have any specimens to run. So when we go live, it will probably not be with the full capacity on day one. We'll work our way up to it as we have done with everything else.
Okay, great. And then just more of a kind of a hypothetical epidemiological question for you. Obviously, I think everybody's watching what's happening elsewhere around the country, and record numbers in so many states. Most of these are not close to us, but even with all the face coverings and the precautions that we're taking here, I mean, how confident are you that we're going to be able to keep numbers down when it seems like the virus is just spreading nationwide and we're such a mobile, society as it is? Are we going to see a spike? If we continue seeing spikes elsewhere around the country, is that unavoidable?
It is a risk, Kevin. And I'm glad you raised that front and center. The possibility of a surge of cases, as has been seen in the South and the West and the Southeast, is a risk here in Maine, as it is for the entirety of the Northeast. There's not a single region or state that is immune, I guess, as it were, from a recurrence of COVID-19. The way in which it could happen here, there are many ways, but what is one possibility is that the number of cases rises to a point at which we start having a number of facility level outbreaks again, as we contended with back in March. That's a scenario that I'm particularly concerned with. It's one reason I keep kind of talking about what the National Guard is doing, because that's a key piece of the protection of congregate care settings. But Kevin, to give it to you 100% straight, the possibility of an increase of cases, as we've seen in other states, that is a risk here in Maine.
Great, thank you.
You bet. I'm going to turn to Steve Betts next.
Yes, good afternoon, Dr. Shah. If these trends of the last few weeks of the number of cases in Maine and hospitalizations continue into September, what would be your recommendation concerning, particularly in rural areas, of having school be in-person education rather than remote learning?
Yeah, Steve, it's a good question. We've been very closely working with the Department of Education on just that issue, both from the rural aspect as well as from an urban setting aspect. And as your question suggests, Steve, we do and have thought about the way we approach rural areas slightly differently from urban areas or more densely populated areas where community transmission is occurring, with one big caveat, which is there can be outbreaks in rural areas, as we've seen not long ago in Holton. So with respect to education and in-person education particularly, our baseline assumption going into the fall is that in-person education, classroom-based education should occur. For all the reasons we know that in-person, face-to-face classroom education is a good thing. I think the question, Steve, is under what conditions in a rural area we may decide to pull back on that or put additional safeguards into place. If, for example, we detected an uptick of cases in Piscataquis County, what would that uptick mean? What would it need to be for us to put special protective measures in place at schools? And then B, how significant would they need to be and in what setting? Should it be at the entire county level? Should it be at the sub-county level, at the district level, or even at the level of the school? Those are the kinds of discussions we're having with the Department of Education right now. As you can imagine, Steve, and as others have seen throughout this entire outbreak and pandemic, the way that we approach these questions is not a simple binary, yes, no, the light is on, the light is off. It's a spectrum, it's a sliding scale based on a number of factors that we're seeing. The number of cases, the setting in which those cases are occurring, the possibility of children being infected, and then the public health response that goes with that. I know that was kind of a long answer, Steve, but the bottom line there is that A, it's a really difficult equation, and B, it's one that we're discussing right now as a way to both get kids back in school, but simultaneously keep them safe.
Thank you.
I'm going to turn to Dustin at New England Cable News next.
Hi, Dr. Shah, and I'm sure your barber was happy to see you recently. Happy Monday. How is the state thinking about the planned Trump campaign rally at Pease Airport in New Hampshire? And is there concern about an outbreak from that? Should people from Maine who go get a test when they return here?
Sure thing, Dustin. We're aware of that event that's occurring this weekend. I guess I have two pieces of advice for anyone who may be going to any large gathering whatsoever. If you're planning to attend any large congregate gathering of any sort, please wear that face covering. It really is a way to keep other people around you safe. If everyone at any type of event were wearing a face covering, the likelihood of transmission goes down significantly. The second, and I recognize this is harder to do, but the second is if you are at any kind of gathering of that nature, try to keep as much physical distance as possible between you and any other person next to you. Both of those pieces of advice apply even more so if you're someone who's elderly or has a chronic medical condition, or alternately, if you live with someone who's elderly or you live with someone who has a chronic medical condition. Those are all the more reasons to keep both pieces of advice in mind. Now, Dustin, with respect to your second question, the standing order that the state issued now about a month ago specifically authorizes testing, makes testing available to individuals who have recently attended any kind of large gathering of any sort. So if an individual does attend that gathering or any gathering and they come back to Maine, the standing order would apply to them if they would like to be tested.
Now, if there was an outbreak in New Hampshire because of this event, if that state saw a spike in cases, would there be an update to the out-of-state visitor quarantine on New Hampshire residents?
It's conceivable. I don't want to comment on any hypothetical. We'd have to see what the data were, how significant they were, what the nature of the outbreak was, with whom it was connected, all of those things. So again, Dustin, it wouldn't be a simple or binary yes, no, but it would be a consideration. What I will say is that I am in very frequent contact with my counterpart in New Hampshire quite a bit. And so there would be quite a lot of communication and teamwork and collaboration between our agency and their agency there to make sure that the investigation proceeded.
Thanks.
Thanks, Dustin. I'm going to turn back to Caitlin.
Hi, Dr. Shah. Can you hear me now?
Much better. Go ahead, Caitlin. And could you take it from the top?
Bless you. Yes, I have two questions. One, have we formally closed any more outbreaks that have occurred at either nursing homes, group homes, or workplaces? And do we ever determine what caused the state employees at the MEMA building to get sick?
Great. So, Caitlin, we have closed a number of outbreaks at facilities, congregate living facilities of the type that you mentioned. It's actually a decently long list, so much so that in the same way that I don't read out the number of pending outbreaks, I've also not decided to read out the number of closed outbreaks because it's a fairly long list, and that's a good thing. We can get that list for you with one notable caveat, Caitlin, which is that group homes may only have 1 or 2 or 3 individuals living in them. Well, 2 or 3 or 4 individuals living in them. And so for privacy purposes, we're not releasing the names of outbreaks that have occurred there, but we can certainly get you the list of other closed outbreaks in larger congregate care settings for sure. And then with respect to the sort of illness that occurred at the Maine Emergency Management Agency, our environmental health team has continued to investigate that. The current theory is that it was related to the potential for growth of a type of bacteria in the humidifier. It's a type of bacteria that's still being tested for right now. It's a very slow growing bacteria. That's why it takes a long time to culture and test for. But if our hypothesis is correct, this is a type of bacteria that produces what's called an endotoxin. It's a part of the cell wall of the bacteria that when run through a humidifier and then run through an HVAC system, it can spread quite widely. And it would explain why a large number of individuals had rather immediate onset, but ultimately mild symptoms spread across that building in MEMA. The test for that bacteria, again, takes a long time because of how slow growing it is. The name of the bacteria is Pseudomonas. But if our hypothesis is correct, the bacteria may have grown to a point that some of the cell wall might have sloughed off, gotten put into the air by the humidifier, and then picked up by the HVAC, circulated around to a number of people. This type of phenomenon can cause a lot of people to get mildly ill over a rapid period of time. The test results for everything else have come back negative, so that's our leading candidate at this time.
Okay, thank you.
You bet. Okay, well, one other programming note, folks, before we adjourn for the day. We are taking a look at these briefings and how we are planning on doing them going forward. Right now, we're still planning to meet again on Wednesday. We're also talking with various stakeholders about how we may do these briefings in the future. We are committed to making sure that everyone has the latest and most timely information. So it's something we're thinking about right now, and we'll have more updates for everyone later this week as we continue. But I just wanted to flag that we're trying to evaluate the way to balance getting information to folks in a timely and accurate way, in a way that allows us to make sure that everybody knows what's going on. So stay tuned for more information on that. And with that, I'd like to thank everyone for your time today. As a reminder, please wear a face covering as you are going about your day, and most certainly as you are going about your day if you're going to be interacting with folks at the grocery store, at a retail store, or even just outside. It is one of the surest ways to show respect for one another. And frankly, I think right now in these difficult times, when all of us are anxious, wearing a face covering is what we owe to one another. So with that, thank you all for dialing in this afternoon. Have a great afternoon. Please be kind. Take care of one another. We'll talk again on Wednesday.